what we're realizing as a society is that there are a lot of ways to keep our communities healthy. We need clinicians, for sure. We need nurses, PAs, pharmacists, etc. But above and beyond that, there are all these other factors that lead to our ability to be healthy or not. And that's really where public health comes in. And my trajectory was I went from a liberal arts background, I served in the Peace Corps overseas, and that's where I really discovered the role that public health plays. So I got my MPH, and then I went to med school, and I practiced for about 10 years, and then now I've come back to public health because I really believe that's where the greatest power lies in really affecting broad changes that can make our populations healthier and a way to address those populations that have disproportionate health burdens that lead them to have less positive health statuses. I'm the director of the Masters of Public Health program here at Northeastern, and the other piece that we have is we have a combined Bachelor's of Science MPH program, a 4+1, that's available for health science students. But a lot of our coursework is available to seniors, so if you can't take advantage of the BS MPH because you're not in health sciences, but you're interested in public health, I really encourage you to be in touch with me so that we can sort of think strategically about how you can continue to pursue your interest in public health, whether or not you ever decide that entering the public health field or getting an MPH is in your future. So broadly speaking, for me, public health is about how do we create the conditions where people can be as healthy as possible. So some people say, how is it that we make the healthy choice the easy choice? So, pizza's an easy choice here, right? It's the only choice, right? But for many people out in the world, when we think about health behaviors, why don't people exercise more? Why don't they eat a healthier diet? A lot of that is constrained by these external factors. So within public health, a lot of people define public health is how do we assure the conditions in which people can be healthy, so that we're moving away from saying it's just individual behavior change that we're focusing on. We're really looking at these broader determinants about what makes or keeps people healthy. So within public health, it's about an interdisciplinary group of people, so folks who have the skill set to figure out what the problem is, so being able to assess when there's a health issue, when there's a health issue that's affecting broad communities, how do we understand the cause of it? How do we develop policies or programs to begin to address that? And then how do we assure that those policy programs are sustainable over the long haul and that they actually do work? So, in my classes, I often show this diagram that sort of breaks down public health into all these components. The other way to think about public health is as this huge umbrella. So there are multiple disciplines that contribute to successful public health initiatives. And I think that's the piece that I hope for all of you, regardless of what brought you here today, is that by hearing the stories from each of the other panelists, that you begin to see that there are a lot of ways that you, through your work, through your interests, through your passions, can really contribute to positive health change that's sustainable. And in this day and age, I think sustainability is really a key issue because the finances are questionable, so we need to think creatively about how we identify the problems and how we solve the problems such that we truly are making the world a better place. So those are my intro comments. I'll let it go through, and then I apologize, I have to leave in about 20 minutes. So Susan has all my information, so you can email me. I'm happy to talk with folks at further length.
I suggest if you have any questions right now, so you can answer them in person. If anyone has questions, usually we'll do the questions at the end, but just because of scheduling. Yeah.
Did you do a Peace Corps and PH combo? I think some schools offer that.
Right. A lot of schools of public health have a reciprocal relationship where your Peace Corps time either can serve as your practicum learning for your MPH or where you do your MPH and then you hop into the Peace Corps. So I did not. But that's another great alternative. There are pros and cons to that approach as well. Certainly what I learned in public health after I was a Peace Corps volunteer probably would have helped me do a better job as a Peace Corps volunteer. But I think you're going to have that throughout your life. You can always look back in hindsight about, oh, I wish I would have known that when. So definitely worthwhile exploring those opportunities for combined, killing two birds with one stone. and I'm a total proponent of Peace Corps. We can talk more about that too. But that really changed my life. And I guess the one piece that I would throw out is that I've never run into any graduate student, whether that's in the MPH program, whether it's in medical school, when I've worked with residents and other physicians, who regretted taking time off. So I think the other piece is to not feel like you have to rush into making a decision about graduate school, but really, taking the time to explore your passions, get to know yourself better about what you're good at, what you really enjoy, so that when it does come time to making an investment in terms of graduate tuition or time or energy, that you're making the best decision that you can at that time.
Yes, please, I second that. Who else has a question? Not right now. Okay. Can we have the people in the hall just come on, scoot in and sit on a rug or something?
There's lots of room right here, and this seat's going to be empty in a little bit.
So if you'd like to be on the panel, there's a place open. Okay, next I want to introduce Rachel Gerber, who is a research analyst at the Human Services Research Institute.
Hey everyone. I also got into public health with the Peace Corps. I wasn't sure what I wanted to do after college, so I did the Peace Corps. I was in Togo, in West Africa. And that's, after that experience, that's what brought me into public health, and I did an MPH. And now I work at a nonprofit organization in Cambridge called Human Services Research Institute. And we've been contracted by a federal agency, the Center for Substance Abuse Prevention. It's in the Department of Health and Human Services, to analyze all their national data on substance abuse prevention and HIV prevention, and to report back to Congress, the outcomes. So a lot of what I do is very quantitative, and that is a big part of public health. And it was something I sort of wasn't expecting coming from the Peace Corps into an MPH program. No doubt you'll be working with biostatistics, epidemiology. A lot of what I do is analyzing data, running numbers. These are really big data sets that we then report back to Congress, and that the results are used to help inform their policies and funding for prevention all throughout the U.S. And I like it a lot. We do get to also travel to D.C. frequently to work with the agency, and also CSAP, which is the federal agency, they give money to states and community-based organizations that are doing prevention programs, all throughout the U.S. So we do get to sometimes interact with the people who are implementing those programs, like project directors, and help sort of disseminate the results that we're finding. And so I guess that's my job right now. And I'll be happy to answer questions.
How would you suggest someone following your footsteps?